73rd of annual conference of CSI in Hyderabad. Myself Dr. Subroto, and today my topic of discussion is that the inflammatory responses of cardiovascular diseases, or you can say the role of inflammation in the coronary artery disease. Especially I will talk about the CANTOS trial that has been done in 2011-2013. So before going this topic, just I want to have some brief point that initially what we do to reduce the cardiovascular mortality is to reduce the lipid lowering therapy. Our main strategies to do the CV events reduction is the lipid lowering therapy. But definitely after this Jupiter, there has been come with a very strong point in that. But later in future, in this many one of the studies came where this CANTOS especially that is done with the canakinumab. So this is a drug which is a fully human monoclonal antibodies, which is mainly used for the rheumatologic disorders, which is mainly anti-inflammatory drugs properties, and especially it reduces the interleukin 6 and hsCRP. The main part is that in this study they have taken almost 4,000 patients, and they have two arms with the placebo and with the canakinumab. And what they found, the level of LDL is same, in the same time the CRP level is reduced, and with that they have got a CV mortality of significantly. That means if you want to go for a inflammatory pathway, that also you can have a very good response for the CV mortality. Not only the lipid lowering therapy is the only options. Definitely in future it may be the points may be here. Similarly, others also, if you see PCSK9 inhibitors, the study was 4 year, and then the Odyssey trial. In both the trials, they have shown one 4 year is done with the evolocumab, and this Odyssey done with evolocumab. Both this is approved by US FDA for the reduction of the LDL cholesterol. But still they have got the benefit of hsCRP, that means the inflammation. That means that not only that lipids is important, the inflammation is also very important. And another study is that is called the colchicine, the colcott and the colchicine, both is done with the colchicine that is given in the patients of just prior to PCI, and as well as the 30 days on PCI, 30 days of the MI during the 30 days period of the MI. So results are very important, very enthusiastic, and we have got a very good results in that with the reduction of the giving the patient of a heart attack only other than this also, because we are giving only the anti-inflammatory drugs, that also given the very good CV mortality. And another investigator of the colchicine PCI, he has quoted very clearly that in future it may be that the colchicine may be the 5th drug that can be added, another drug to be added on the after MI, just like after MI what we give aspirin, clopidogrel, statins, beta blocker, ACE inhibitors. Other than this, we can have some colchicine drugs, but there is a little side effects of that because that also can be managed with the low dose, and dose adjustment in the future can be in better way. So ultimately we can say that the lipid lowering therapy is not only the only thing has to be kept in mind. We can have the options for the reduction of the CV mortality with anti-inflammatory drugs also. In future is this. So you have to gear up with the other drugs which can use this. Now the other studies has been done with the methotrexate also, but the results are not very enthusiastic in this methotrexate trial. There is a CRT trial, but I think in future we have to keep in mind that anti-inflammatory drugs can also be used and may also be in future as add on to the heart attack or cardiovascular mortality benefits. Thank you.